Okay, hi everybody. Welcome to another week. We have a lot to cover right now, so just a heads up of what we're going to be talking about. So we're going to be spending the bulk of our time today walking through a COVID preparedness plan. Kari Everson will be joining us in a few minutes. She's on another call, but when she's done, she will be joining us and we'll start walking through that. Another thing that we're going to be doing until kind of what we'll be working on before Kari joins us is I'll be walking through our reopening checklist that we are developing, which will include a number of different links to draft policies and sample communications. So we'll walk through that briefly before Kari joins us. Also, again, just kind of open it up for questions and see where people are at in the process of reopening. So feel free to turn on your cameras, unmute, whatever is most comfortable. And just curious how many people here have already, if anyone on the call has already reopened and how that's been going. So if you have, either note it in the chat or unmute and let us know. I know I've heard of a couple of providers that reopened last week. So I'm curious if anyone in this group has already done that and how it's been going. Okay, so I'm going to assume that no one in this group has reopened yet. Oh wait, I see a couple of chats.
This is Pat from Northfield. We're exploring it. I'm looking at it financially right now. As much as I would love to say, yes, we're opening tomorrow, 50%, I have to make sure we have enough money to pay our staff. So kind of looking for some more holding off, I guess, right now. But we're working on it.
Okay. And then I see Rachel from Treasure Time Adult Day did reopen. Rachel, if you have a sec, could you unmute and just kind of fill us in on how it's been, I know it's the first day, but how your process went in getting prepared to reopen?
Yeah, I didn't think I would be ready for today. We were kind of planning on today, just having a meeting with my staff and stuff, but I managed to pull it together and get my policy thing filled out and think we're doing okay. We only have 2 people here today. So it was really just kind of a trial day. And I said, it feels like my first day of school and I'm not sure where my classes are, but we'll figure it out.
All right, that's great. So yeah, I'm sure you'll be really helpful when we walk through this COVID-19 preparedness plan. So so that's great. I'm glad to hear that you're open, and I bet your community up there is really happy to have you guys back. So we're gonna, until Kari gets on, we're gonna walk through just this one piece that I want to give you a preview of. I'm gonna share my screen with you and show you this. So you have an idea of what we've been working on this past week. So this is an old version. The final version we are hoping will be out on Wednesday and will include all of the links that I'm going to talk about. So it's a checklist to help providers in their reopening. We've talked about a little bit on here on just some of the paperwork pieces that you need to have completed, the notification about resuming facility operation in your center. So that's something that you would submit to DHS. You can do so electronically just by clicking on their link, or if you want to fax it or email it in, that's an option that you can do as well. And then that COVID-19 preparedness plan, which we'll walk through in more detail on this call. So determining who will be coming back, how you will cohort them, and sort of factors that you should consider on who should come back. So we've listed a number of these down here. This list isn't exhaustive, but it is just sort of some thinking material, kind of thinking opportunities to think about who should come back, who's at higher risk, and then clearly those are conversations that you'll be having with individuals and their family caregivers. and then kind of operationalizing it. So developing, working with your staff, figuring out transportation, communicating restrictions to family caregivers, things like that. We will have some sample communications that you can use relating to arrival and departure procedures, relating to a suspected case of COVID-19 in your program, relating to reopening and what that would look like. So just know that those things are in the works, and they will be available soon. We also will have some training links in here. I don't know how many of you use Educare for your training needs, but they do have a number of COVID-specific modules that they've developed and are available to both their members and then also available to non-members. So we'll have links there where you'll be able to connect with them and access the training that they have available. Then we're walking through a little bit more on the social distancing, how providers can do that. Resources, I know there was some information that came out through the Adult Day listserv from Brandy down near New Ulm about a provider down there who is developing or has created some physical barriers that seem to be working well. So if you're having a hard time finding that type of material, that plexiglass or those other materials that you can use as physical barriers, you may want to look into that. Additional policies that we have developed are relating to PPE, visitors, limiting visitors, staff and participant screening. All of those will be available to you just to work off of and to have a guide. And then again, down here at the bottom, we have some sample communications, like I mentioned, about drop-off and pickup procedures, the screening protocol on site for participants and staff, precautions for COVID-19 for participants and families, and then, like I mentioned, that letter for communicating positive COVID-19 in your program. So that will be coming this week, all of these resources. This is, as you can see, in draft form, a working document that we've been working on internally, so it's not complete yet, but I just wanted to give you a little bit more of an idea of what you can expect to help you through with some of your planning needs. So I'm gonna check and see if Kari has joined us, and she has, so Kari is on. Kari, are you on mute or are you ready to get going?
Good to go whenever you are.
Okay. All right, so great. So Kari, we just walked through kind of the draft checklist of things that providers can expect to see from us this week. And then we can kind of go from there and jump into the COVID-19 preparedness plan.
Great. Roni, do you have a copy of that document that you can put up on your screen? I can't share my screen.
Yep, I can get it up. 1 second. Here we go. Okay, so I'll start at the top, and then do you want to just tell me when to scroll down?
Sure. And I don't know that we have to go through. I think what people are mostly really wanting to talk about is when the template starts. Am I correct about that, ladies and gentlemen? Okay. So if we could just scroll, Roni, down this page and the next page. I think the template starts at, there we go. Okay. So this is their COVID-19 preparedness plan, and they've got in red where your organization or your settings can put in information that is specific to you. So there are some easy things like your company name, or if you're talking about a client or a participant or a family member or guest or visitor, I think that's the easy stuff. I think the places where people are struggling or maybe want to just know how others are doing it is when it talks about describing your policies or what you're doing because of that. So I thought we could start by talking through that. So before we go there, I will just remind everyone that at the very end of the guidance, there is a list of links where they have pulled some of their stuff from for this plan. And there are a couple of places in here where it says, describe which community guidance you've used or which other guidance you've used. And they've referenced things like salon guidance or other things like that. I think they've already given that to you at the end of this document. And I think that you can really reference and what's most applicable to your settings, maybe not the only things, but easy to reference in this document would be the CDC and MDH guidance for other settings that serve older adults. And so anytime you see that, it would be probably easiest to deal with that, because they've cited in their example like other industry guidance such as restaurants and bars, manufacturing, construction. Those really aren't like agencies to Adult Day. And they've done that because they don't deal with the other congregate living settings. But for your use, that's where we would talk about that. So when we first talk, so the first area that comes up, really where it says describe, is this, let's see, third paragraph down that Roni's, nope, go back up, Roni.
All righty.
You were just fine where you were. There, stop there. Okay. So it's the paragraph starts with our workers are our most important assets. And then the end says, describe how worker suggestions and feedback have been solicited or requested, how worker concerns have been addressed, and how suggestions have been integrated into developing the plan. So I'm just going to give some thoughts on what you can put in there. And then if anyone else has opted to put something else in there, many brains are better than one brain. So if you've got something else in there, please speak up and let us know so that we can have the best possible information for putting this together. So as I was thinking about operationalizing this, we have to give some education to our staff about COVID and infection control practices and what our policies are going to be when they return. And that might be a good time to also solicit some feedback on if they have questions or concerns. The other thing is, I know some Adult Day services programs have already opened while others have not. And I don't know if for those of you that have opened, if you had a quick staff meeting prior to the opening, or if you haven't, might be a good idea to be able to address in real time some of those suggestions or concerns. And then you can just put in your plan that that's what you have done. And just like any concern process or complaint process that you have, it's a good idea to document those concerns and how you responded and followed up in the event that a regulator would come in and ask that question based upon your COVID plan. So those were a couple of suggestions that I had. Did anyone else who's done this already put anything different in here?
That's basically what I put in there, is just that we had staff meetings and discussed, kind of walk through the day and how things would best work.
Perfect. Then the only other question I have is, has anybody thought about putting because we all have to have concern and complaint processes in place. Has anybody thought about putting in place a process by which staff can ask questions or talk about things going forward? Has anyone considered that or done that? Okay, doesn't sound like it. I don't know that it's required. I'm not asking because I think it's required, but it might be something that you may want to look at because that's an easy thing to put on here for ongoing stuff, although it doesn't say that you need to have an ongoing process for that. So yeah, I think that's a good idea. And then in the next couple of paragraphs, it talks about some minutia stuff and some things that we have to look at. So I'm not going to really stop and spend a lot of time on those bullets unless people have questions on them. I'm just really going to spend time on the places where you have to write stuff in. So does anybody have questions on this paragraph or the bullets? And if so, let's talk about those. And if not, then I'm going to move on. Okay, hearing none. The next paragraph with some red in it, and this is the one where it says that the company has reviewed, nope, you can stay right there, Ronnie, has reviewed and incorporated the industry guidance applicable to our business provided by the state of Minnesota. And then in that red, it's got identify industry guidance if applicable, such as restaurants, bars, manufacturing, or construction. So my thought is in this area is where you would put guidance from the Center for Disease Control and Prevention and guidance from the Minnesota Department of Health. Those tend to be the most applicable to your settings. Does anybody think of, or have you thought that there might be other guidance that you want to put in here? Because I know there is some guidance on ventilation protocols and things like that. So has anybody thought of anything else that they thought would be good to put in here? Okay, then Roni, if you want to scroll down to the next little bit of red. Okay, so this section talks about sick workers and identification and isolation. And so we've talked, it's got a little statement in here saying that workers have been informed and encouraged to self-monitor for symptoms of COVID. And then it talks about the following policies and procedures are being implemented to assess workers' health status prior to entering the workplace and for workers to report when they are sick or experiencing symptoms. Here's where you'll indicate your policy listing. And so you're gonna have a employee screening policy, and then what to do if you're sick, it's got in there, and the ability whether they can return to work. That's all in one of the policies that I've put together and will be coming out. And I think many of you received that draft form. So it'll be those policies. And then in addition to listing the policies, you may want to put some wording in here as to how you will address that. And you can take some of that language right out of your policy. My suggestion is that in this plan, you don't plan yourself into some sort of citation with the regulators. So I think this plan, as long as it references the appropriate policies and gives a quick overview of how you're going to accomplish that, having them inform you of self-monitoring for signs and symptoms, how you're assessing their health status, and how to report when they're sick. You can do a quick sort of summary paragraph and then address or reference the policies. That keeps you from having to change policy language should the policy language change and having to change your COVID preparedness plan. Does that make sense, or have I started speaking Latin to people? Nanette, I see you nodding your head. Am I speaking Latin to you, Nanette? Okay. So let's do an example then. This one says, how are we going to address? Let's just take screening. So I would put something in here saying the policies, we've put policies in place to address ensuring sick workers stay home, and we've got prompt identification and isolation of those sick healthcare workers. For screening, we have a screening policy and procedure, and our staff will be screened prior to coming to work within the program, period. Then you don't need to explain how they're going to be screened or what you're going to do, because you've already got in your policy, right? And if you update your policy, but you put the detail in your plan, then you've got to go through and update your plan too. And having to update both documents, there's an easier chance for there to be an error in one or the other document. There's also an easier chance that people get busy and forget to go back and update one. And certainly if you have somebody coming in to survey your program, you don't want to leave it open for incongruity or a difference between your policy and your COVID plan, because then that's a rabbit hole nobody wants a regulator to go down. Does that help a little bit, Nanette? Did I clear it up, or am I still speaking Latin? Okay.
Kari, so are you, would the recommendation then be that all the providers develop all those policies first and then use those policies to inform their COVID-19 preparedness plan? The work will already be done, but the plan is just kind of a way to bring all of those policies together to make sure that everyone is health and safe in the program. Is that the best?
Yeah, I guess,
Yeah.
yes, that's exactly what I would recommend, Roni. And I guess I look at this COVID preparedness plan as a summary
Mhm.
of all of the things that you're doing, but it doesn't have to have every single bullet point in it, because if you reference the appropriate policy, your process is in that policy. So
Okay,
this is the summary document that we should be able to provide.
Okay.
Okay. Any other questions on that? I'm just going to pause for a minute because I don't want to fly through this too quickly. And I know sometimes people have to mute or unmute or type in the chat. So I'm going to have a little pause here, and it may be uncomfortable, but we're just going to do a little longer pause just to make sure I'm not going too fast.
I'll jump in too and just say that I think that, looking at this, it's complex and complicated. So even if you're starting from what might feel like 10 steps behind where we're at in this discussion right now, that's what this group is for, is to get all of those questions answered. So please don't be shy. Ask those questions, because chances are at least 5 other people on the call are thinking those same questions as well.
So Betty asked, did you say there was a list of the policies that we need? We do have a list of those policies that we're working from that we put together. But if you go to the reopening ADS guidance, it says right in there which policies that you need. Sorry, I'm beeping and buzzing over here.
That's okay. And for some reason, I can't see any of the chat. So
probably because you're sharing your screen. So I've got it open next to me, Roni. I have trouble viewing the chat when I'm doing that too. So I will read off those questions.
Okay, great.
So if our agency has a general plan in place that doesn't follow this format, should I rewrite it or just amend the other? That's a great question, Maria. And I don't think that it is essential that you follow this format. Frankly, if it were me doing it, this is not a format I do my action plans in, because it's very wordy and, paragraphy. But I certainly think that you could then take the pieces and parts from this document and incorporate it into the plan you already have together. They haven't mandated that this is the document you used. I think they put it out for something for people to follow. So as long as all of the pieces and parts are addressed, I believe you're fine. Just make sure then that you double check it and address all the pieces and parts, because then when you transfer from one document to the other, that's where we end up missing things. And then of course we've got holes in our plan. But yeah, I think you can do that. All right. So then moving on, the next part talks about sick leave policies that promote people staying at home. So you can have done this a couple of different ways. You can have modified your already existing sick leave time off policy to include the quarantine or the isolation. Or you could have designed another policy that is active during COVID. Either way, you're fine, as long as you're following the legal stuff for FEMLA and things like that. And you can certainly address that in this paragraph by saying that, by pointing to your policies, which policies you're using to answer this piece of the plan. And then talking a little bit about that you have policies, you have a sick leave policy, whether or not you've adjusted it, and kind of an overview or summary of what those adjustments are. Now, I would also say that in order to have everybody on the same page, it's probably a really good idea to have this COVID plan in some sort of a binder or document holder along with the corresponding policies so that they're easy to retrieve. And if you have a regulator come in and say, okay, well, in this part of your policy, you said that you put an addendum on your sick leave policy. I'd like to see that. It's nice to have them all together. It's also nice for you guys as a reference or your staff to have as a reference, because then it's easy to look up and stay consistent with those things rather than having to go into multiple different file folders and click and find policies. That's just an efficiency thing. Plus, I'm a fossil, so I do a lot of stuff on paper, because when I went to college, we didn't use there was no internet and we didn't use computers. So that may just be my age talking. Whatever works for you, have them together in one file folder on your desktop. I don't know, but it's nice to have them all put together. Nanette, are you laughing at me? You got your paper. I love it. We're kindred spirits. And then the next little bit talks about a person if they've been exposed at their workplace and requiring them to quarantine. So we have this in our policy. It is what happens if someone has COVID, when can they return to work? And there is a test-based strategy and there is a symptom-based strategy. So you should review those, decide which you're going to use or both, depending upon the situation. And in this section, I would reference that policy and say that you will be utilizing the CDC and MDH guidance on the return to worker criteria, including the test-based and or symptom-based strategy. Then have your policies available. Any questions on that so far? Okay, is this helpful how I'm going through this, or okay? Yes, I see Nanette nodding. Everybody else good? Give me can you do a thumbs up or something like that with your reaction button? So I know I don't have to change my, okay, awesome. Then I don't have to change my tactic. In addition, they talk about a policy being implemented to protect the privacy of workers' health status and health information. Now you have HIPAA policies for residents. I think you should have some data privacy policies in HR for your employees. I believe they are specifically getting to testing results here. So if you don't have a policy on what you're going to do with those testing results, I've seen that anywhere else, Roni. This is the first time a privacy policy popped up for staff.
Yeah, I don't know if I've seen that anywhere else either.
All right, so I'm going to put that on my list because I missed that. And so see, it helps me to go through this too. And I will then add that to our list of, oh, see, all right. I'm going to turn off at least two of my devices that are beeping at me.
So I'm sorry to interrupt. This is Pat Shirley from Northfield, and I had to take an emergency call, so I kind of missed the first part of this. Are you sending this out to us?
This document?
Yeah.
Actually, you want to know what? I will put the link in the chat right this very second.
Awesome. Thank you.
Yeah. So while we're talking through, I will put that in there. Okay. There you go. So I will look at a policy and procedure for workers' health status so that we've got something we can put in there. In the meantime, you can put a privacy statement in here very similarly to what you put in for residents, that the healthcare workers' health information, particularly will remain private as always, because you have to do Mantos, you have to do background checks, things like that, and that all must remain private. So there shouldn't be too much more that you have to do, or you can put an addendum in your employee policy about their medical file and it being confidential. Does everybody have that policy? Healthcare worker policy in regards to their employee file and keeping the medical portion of it private?
I'm not sure if people have that.
Okay, so I will take a look at that then, Roni, and see what I can find and get something out there. Okay, so then if we scroll down to the social distancing piece where it says that workers should be at least 6 feet apart. In the workplace, it says the following engineering and administrative controls. Now it gives you a ton of things that you have to have within your organization to be able to deal with this. So I think if it were me doing this, I spent a little bit of time trying to determine how I thought I would do it, because this is a very dense paragraph. And so my thoughts around this particular area was that I would just go in and find something that's, find the first piece. So the first piece really talks about identify protections and protocols that include teleworking, flexible hours, staggered shifts. I would just address that first. So how am I going to address that? And then it talks about occupancy, numbers of people, flow, and interactions. Then I would address that. Then I would address our signage and our markings, et cetera, because there's a lot there and it's easy to miss it. And I think these are all things that you certainly don't need me to explain this to you. You've been thinking already about what does your traffic flow look like? What are your physical barriers going to be? What is your signage going to look like? We've been talking about that for weeks now on these calls. You've asked really great questions, going with these things now at this point in the game, since I think this is our third or fourth call where we've talked about this. Are people feeling comfortable with those decisions that they've made? Or at least, have you thought about them and made them? Whether you're comfortable or not is maybe a different question. Can you thumbs up me if you've thought about these things?
I think another piece to add in here, and Kari, correct me if I'm wrong.
This is Peg. I'm going to say,
I'm sorry, you cut out there, Roni, for a minute.
I was just going to say that piece about the staff cohorting with participants, that would probably make sense to put in here as well.
Yes. I'm sorry, Peg, what were you going to say?
I'm just going to say, we can see it, we just can't feel it. So we're trying to put things or talk about and how so we see how it works, but we can't feel it because we don't have people in here doing it. So it's just going to be going through it a lot.
Yeah, I understand exactly what you're saying. You're trying to plan for something that you have not implemented yet, and it's still, you'll run into all sorts of things when you start implementing, as we always do. So probably a good idea just to put it on your list after, for 1 week from after you reopen, to just sit down and look at your COVID action plan again, because you may have changed some things since then, right? All right. Then Roni, if you want to scroll down to worker hygiene and source controls. Down here, I think it's a little bit easier because it's talking about, under the hygiene and source controls, it's talking about hand sanitizer, sanitation areas. How are you going to make sure that you've got enough hand hygiene areas or supply to meet the requirement? So in this area, I know many of you have put extra hand sanitizer around your community, have installed or purchased mobile hand sanitizing stations. You've done extra education on this. And I think that those are the types of things that you can put in here. You also can make sure to put in here that you've got a hand hygiene requirement for when they enter the program and are screened. you likely will have protocols for hand hygiene during their shift. I would also think that putting something in about managing your inventory is a good thing in here, because you're going to be constantly checking to see whether or not you have enough hand sanitizer or hand hygiene material for your staff and your participants. So I think it's a good idea to include in here monitoring that supply or par level, however you're doing it. Then for the source control, it talks about face coverings and other PPE as required in the industry guidance for your business. So has anyone looked at the PPE contingency grid? Now it's for assisted livings and nursing homes. Has anybody seen that or looked at it? No? All right. I don't know that it will be exactly applicable to your setting, but I think it might give you some help into determining how to write those or how to implement that PPE in your settings. I'm going to see if I can pull this up and give you a link. It's called the Contingency Standards of Care Grid. Now, I will tell you, they talk about environmental services staff, and they talk about dietary staff, and they talk about direct resident care and all of those sorts of things. But I think it will give you a little bit of help in trying to determine what PPE and what source control should be worn and by whom. And then it asks you to talk about how your business will communicate these instructions and reminders. So again, I'm sure you'll have postings, I'm sure you have education to staff, and I'm sure you've sent letters already out to your participants and your families, or will. And those sorts of things should be going in this area that just says, describe how you're going to communicate these instructions. And those of you that had staff meetings or things like that. Any questions so far? Okay. All right, Roni, let's scroll down to workplace building and ventilation protocol. We are actually reaching out to the Minnesota, the state of Minnesota engineering department, because we've had some HVAC questions in nursing homes and ALs as well. There isn't a lot of industry guidance that I'm aware of that deals with ventilation protocols, and I haven't seen anything from the state engineer's office. So I don't have any great guidance for you on this one, but what I can do is I can check and see if John was able to get a hold of the engineer and get us some more information on this. And I will make sure that we get this to Roni so she can get it out to you guys as this happens. In the meantime, I don't know what you're doing with your HVAC systems or your ventilation systems. And I would suspect at this point, at the very least, you would want to say that your HVAC systems are functional, that you continue your routine maintenance on them, those sorts of things to address that, and that you have a plan in place or a vendor that you work with should there be some sort of misfunction or malfunction with your HVAC system. Has anybody thought of anything else they've put in this section? Okay. All right, Roni, I think we can then scroll down to the workplace cleaning and disinfection protocols. Okay. So we have CDC and MDH guidance on cleaning and disinfecting protocols. And we've also talked in this group, in this forum, about cleaning and disinfecting if there's someone in the workplace that is symptomatic or diagnosed with COVID. Now, we realize that this is a situation where we would like people screened and not to come into the program if at all possible. However, We also talked about the fact that someone may develop symptoms while they're within the program, or they may have had a test and someone calls and gives you results while they're in the program, which would not be ideal. If they were getting a test, you would want them to stay home, but there are outliers to every situation. So we've talked about those types of things. Is anybody having trouble with their cleaning and disinfecting policies and procedures, or is that going okay?
Does anyone kind of have an idea of like wondering how to start or where to start with that?
Okay. So in the references that they've given in Appendix A, along with a building, okay. Nanette, you have a question. Your lunches come on trays that are sent back to the hospital. Is it best to use disposable? That really, there is not a best practice for that one, Nanette. Some people are using dishes and some people are using disposable. I think that there was some discussion that we had with the department, we being leading age, early on, that as long as people are wearing, you know, the appropriate PPE when picking up the dishes, because it's not so much the dishes as it is contact with the residents. However, there is some contact from solid surfaces. So as long as the person is using the correct precautions, you certainly can use dishes. Otherwise, many people have gone to disposable because it's easier and less difficult to deal with from an infection prevention standpoint. Does that answer your question, or did I just completely, am I Latin again, Nanette, or did I answer it? Oh, your dishes are disposable, but your trays are not. No, you can continue to use those trays. That should be fine. All right. So there also is some cleaning and disinfecting guidance down in the Appendix A, where they've linked some things down there. I think the biggest thing to remember to address in your cleaning and disinfecting guidance is that things need to be cleaned prior to another group of people or participants entering and after they have left. And it's important to, any of your cohorted areas or grouped areas, make sure that you have a cleaning policy for that, particularly if you're going to be rotating people around within the program. Maria asked what we advise for easy lift slings. If you're following a true infection control and prevention process, then each person would have their own sling, and that would be put into a bag or something between times, and only that sling would be used for that participant. Does that make sense? And then Christina put in the chat that they are going to use some fogger along with disinfectants, which you can do. And there is some, I think we put out on the coronavirus webpage under the ADS section, a list of disinfectants. And there are some spray disinfectants, particularly for cloth or non-hard surfaces. So you might want to take a look at those too. Okay. Roni is working on the drop-off, pickup, and delivery practices and protocol. Again, I think that you can give a summary of what that policy will say and then link to your policy here. And then do you want to scroll down to communications and training practices and protocol? Okay. The first one talks about a preparedness plan and how that was communicated to the workers. And it does ask for specific dates when the plan was communicated and when the training was provided. So you'll have to put those dates in here. As to how the plan was communicated, I know that it has to be posted within the community, so that's there. You're also going to have to give a copy to the participants and their responsible parties and to the staff. So however you do that will be very individualized. So you can just describe that in here and put the dates in. I do not think you need a separate policy for it. I think you can just do those things and document them. Then there's some additional training that will be ongoing. And so describe how the communication and training will be provided. And again, that can just be your training plan. I don't think that you need a separate policy on this right now. I think if you put it as part of your COVID plan, you should be fine. You already have your initial training policy. Instructions will be communicated to workers, including employees, temporary workers, staffing, labor pools, independent contractors, subcontractors, vendors, and outside technicians. So this one may get a little sticky, and I would suggest that you have a tracking form if you've got frequent vendors like your medical supply vendors, so that they understand that you too are going to have some screening protocols. And then you have some decisions to make. Are you going to have the supply vendors drop the supplies at your screening station, or are you going to have them screened and have them bring those things back to where they would normally deliver them? That's very community specific, program specific, but you should think about those types of things and whether or not you're going to let vendors or other workers back in your program to drop things off. And then the rest of it is just really, again, masks and face coverings come up again here. Symptoms come up again here. And then the last really big thing, if you'll just scroll a little bit down, Roni, is it really talks about how you're going to monitor the effectiveness of the program and talk about successes, challenges, and deficiencies. And I think part of that is you just decide how often are you going to review your action plan. I would suggest weekly for the first little bit until you are pretty sure that your action plan is stable and there has not been any change within the ADS community. And then I would just have a staff meeting or whoever is meeting about this and just take some meeting minutes to be able to prove that you are watching the effectiveness, you're looking at where things are working, things aren't, and how you're changing that. And I would keep those meeting minutes in the same place. We'll keep this plan and the policies and procedures that are encompassed in this plan. And then the additional protections and protocols, that one is just, I don't know how to answer that for you. You're gonna have to go through and see if you've got anything else going on in your program that needs to be addressed. Now, if you complete your COVID action plan and you want me to take a look at it, or you want me to take a look at a specific piece or part, I'm certainly happy to do that. Just send me an email and attach your document so I can take a peek, and then I can give you some recommendations for tweaking that document if you'd like. Certainly you don't have to. I just know some people are more anxious about it than others. So some of you will go out and implement and won't look back, and some will have questions. So I think that's easiest if you just ask the questions, or if you want me to look at a part of the document, fine. Either way, anyone that works for you. And then Jill's got a question in the chat that says, you've seen that there is a recommendation for 14 hours between cohorts served, but many of the approved learning products do not require much more than an hour to sit. Can I provide any clarity? Oh, 24 hours. 24 hours between cohorts served. You know, I think, Jill, if you deal with that in your cleaning and disinfecting protocols, that should be fine. Do you have anything else to say about that, Roni? Because I know sometimes you may want to move around the cohorts. Like you said, some activities are an hour, and I think appropriate cleaning and disinfecting in between is all you need. But I don't know if you've heard anything else, Roni.
Yeah, I'm not sure, Jill, maybe you can unmute and fill me in what you're referring to about a 24 hours between cohorts.
I'm not remembering off the top of my head where I read it last week. It was kind of an overwhelming week coming back from vacation, but I just remembered reading something that said 24 hours between groups served, and I'm not sure exactly where that came from, but it's not consistent with what our product labels and CDC are saying.
So the guidance that I've been hearing is that you can serve more than one cohort in a day. So if you have a group of, you have multiple shifts throughout the day, which I think is how some providers are planning on implementing this new kind of world of adult day services. So if you have a group coming in from 8 to 11, and then you have another group starting at 12, you don't need to wait 24 hours between groups participating. So I'm not sure if I'm understanding the question correctly, or I can try and see if you might have seen that 24-hour sort of waiting period, but that doesn't ring a bell. And I know that in our conversations with DHS, they understand that providers will need to sort of develop shifts, multiple shifts throughout the day in order to serve clients.
Okay, great. So we have about 10 minutes left. Any specific questions on this particular document, or any questions on infection prevention practices or anything else surrounding reopening that anyone has? Or Roni, do you have anything you want to add?
Not on this topic specifically, but before we go, I do have one more little plug.
Okay.
Are people doing okay getting PPE? Has that been an issue? Are you finding it?
Just to let you know, our suppliers of PPE in Northfield told us the gloves are really going to be in short supply over the next 2 months. So if you have boxes of gloves, better keep them very close at hand. The other stuff's coming in pretty good right now, but gloves are already at short.
So Gail in the chat is saying so far so good. Maria is saying that they haven't been able to get surgical masks. I too have heard that there may be a little trouble with masks and gloves in the coming months. So maybe worth it to order a little extra to have on hand. I know some people have the finances to do that and some people don't. Just a head up there. Mary said they haven't had any problems so far. So I think Costco right now has some in Brainerd, and Rachel says she's also getting on Amazon. Kat says that gloves and masks are back ordered still with her supplier.
So I know we had shared a while back about some additional resources that might be available through our Savings and Solutions Center, through kind of the regional hubs. I forgot the right term for that, Kari.
The regional emergency preparedness coalitions.
Yep. So those are resources, again, that you could reach out to if you're encountering difficulty procuring the specific type or amount that you need.
I'm going to pop the link in the chat box to the regional healthcare preparedness coordinators. They are done by region of the state. So there's a Northeast, a Northwest, West Central, Metro, South Central, Southwest, you know, that kind of thing. So I put the website link in there because you can then search for your regional coalition and it gives you the contact information along with the counties that each specific area serves, if you don't have that yet.
Great.
Okay, well, I will hang on until the end of the call, Roni, but just a follow up, I did put my name or my email and my phone number in the chat if anybody needs that. And then I think I'll turn it back to you. But if somebody pops up with a question, I'll just be on mute to answer if you need me.
Okay, wonderful. Thanks, Kari.
You bet.
So thanks everyone for participating today. I just want to share one piece that you should have seen. I think it came out over the weekend or maybe even on Friday, that we have moved forward with our action alert for retention payments for adult day services. So you should have received a couple of emails with links to sort of pre-written letters that you can personalize or you can send as is for both providers. There's a letter for family caregivers and there's a sample letter for clients. And our hope is that we can really sort of do a mass email connection to legislators. They reconvened today for their second special session to encourage them to support retention payments for adult day services providers. So we don't know how long the session will be, but we know that kind of the more people that participate in that action alert, feel free to share it with anyone in your center, within your own personal network, the stronger the impact will be. So I highly encourage you to move forward with that. You'll hear me talking about it a lot this week on all of our calls that we host, but it's one way that we're hoping to shore up some financial support for adult day services providers. So I don't know if any other questions came in through the chat, but I think that's it from what we have to share today. Anything else come up, or anyone on mute want to share anything?
Roni, I was just going to share, I don't know if anybody saw yesterday on the KSTP ad issue program. There was a reporter who was questioning Governor Walz about why there had not been any retention support for the adult day services and, those kinds of things. And she was really good. She just kept pushing him and said 35 states have done this and Minnesota hasn't even requested it. And so if anybody wants to look at it, it's at issue July 12th, 2020. If you just Google that, at issue KSTP July 12th, 2020. She had some good points and he just kept talking around it, but they showed the map of all the states that had requested it, and Minnesota is right in the middle of the Midwest with not having done it. So it made me feel good that somebody's out there pushing a cause for us.
Yeah. And we
Is that
did,
yesterday?
Yesterday. Yep.
Okay, thank you.
Sunday morning. Mm-hmm.
we did raise that on Friday with a call that we had with DHS. It's called an Appendix K, and shared with them as well that, the majority of the states in our country have moved forward with that. So it's on their radar. I can't speak for DHS, but it's, I'm glad to hear that we aren't the only ones who are pushing for that. Way to go, KSTP. Anything else before we kind of sign off for today? Okay. Well, thanks everyone for your time. Rachel, I'm so curious to hear how things go. I'd love to hear more about your reopening. I'm really excited for you and your community. And we will all be in touch. Our next sort of large get-togethers on Wednesday at 3:30 for our Adult Day Huddle. So we will see you then. Thanks, everyone.
Thanks, Ronnie.
Mm-hmm.
Thank you.